Welcome back. In today's society, we women are constantly under pressure to maintain our overall appearance. But what happened if one day you suddenly woke up and discovered you were losing your hair and in clumps? Pretty shocking, huh? Well, I'd like to share with you a Southland woman's experience and how she's getting help for a condition called alopecia. Arlene used to have a full head of healthy hair, but says she noticed a change in her late 20s.
It seemed like it was getting thinner and thinner and thinner. I didn't know why. I would get shampoos that said for thickening. I would get pills, vitamins for hair. I went to my doctor, and my doctor at that time didn't think anything was wrong. You need more iron.
Back then, the doctors didn't know what to do. So as her hair loss became prominent, she wore wigs to cover up. She says the entire experience was humiliating.
My self-esteem was just, it was nothing. I gained, well, I'm still losing, but I gained I would say I gained 60 pounds. I was just so depressed. It was hard to even go out.
Dr. Heather Roberts says Arlene is not alone. 50% of women suffer significant hair loss between the ages of 30 and 60. And here are some of the causes: childbirth, crash dieting, emotional stress, medication or cancer treatments, and in some cases, genetics.
So if somebody has a family history of hair loss in any relative, it's not just mother's side or father's side, it could even be a remote cousin, anybody with an early onset of hair loss, it's going to give them a little bit more of a genetic tendency to lose their hair.
Unlike men who have several treatment options, women have a more difficult time in finding solutions that work.
Unfortunately for women, we don't have as many of the oral options that we have for men.
Why?
Because of the problems with fluctuating hormone levels in women. If we start giving women anti-testosterone pills, first of all, in childbearing women, we can't do that because they can have problems with a newborn baby. So that's limited.
Now there is hope for an effective non-surgical treatment. Meet Elgin Charles. He's invented a hair extension unit that is sewn to existing hair.
It's a net, and on the net we have wefted on hair, and at the top, up here in the crown area, we ventilate it, so it'll be very natural, so you can part it from side to side.
In a few hours, Arlene has a full head of hair that can be washed, colored, and styled regularly. All she has to do is go in for maintenance every 3 months. Elgin says the process isn't cheap. The construction of the cap can run anywhere between $1,500 to $3,000. In this case, Elgin got insurance to pay for the process.
You can get the insurance company to cover 100% because it's a unit itself. You're not paying for the labor or a doctor's service. Usually if it's a doctor's service, they only pay up to 80%. But being that it is a particular prosthetic unit, they will pay up to 100%. Maybe 80, but you can work it and try to get it.
Do all insurance companies cover it?
It all depends on your plan. Most HMOs I don't think will, but PPOs do.
With help from Elgin Charles, Arlene has transformed herself from the outside in.
It's hard to explain how I feel. I mean, I can go outside and feel like a person. I feel pretty. I feel confident. And a little choked up because, you know, I've been so bottled up for such a long time about this.
For more information on the extension cap, contact the Elgin Charles Salon in Beverly Hills at 310-477-4727. And for more information on alopecia, contact the National Alopecia Areata Foundation. Now, because Elgin Charles not only runs a hair salon, but a non-surgical hair replacement center, most insurance companies will cover the cap, but only if you can medically prove that you suffer from alopecia.
Wow.
Isn't that incredible?
Incredible story.